So that was a lot of lower body action. You know what that means? Starting to get tired, a little fatigued, a little tense. Whether you're exercising or not, or you're just playing activities, always good to mobilize. I'm going to show you how to do that now. Let's head inside. Now we're inside. That's better. Actually, something's missing. There. Not quite. Much better. Hi, it's Coach Joe from StayFitAnywhere, where I help you get lean, stay lean, no matter where you want to exercise. So today, it's all about my lower body. Have you been feeling a bit more tense or achy in the lower back? Maybe your glutes, the butt muscle, back of your legs, the front of your legs. I don't know if it's more of this home isolation, you're doing a bit more sitting with homeschooling your kids, or lounging around the couch, or you're just anxious and just moving around a lot, and your lower body is starting to become fatigued and stressed. So today, it's all about lower body mobility. I'm going to show you a few exercises you can do instantly at your own home so you can move smoother and hopefully feel less pain. So for this month, it's all about mobility and self-care. So from the top of your head all the way to the bottom of your feet. Well, I want to make sure that you're mobilized and you move smoother and more efficiently. If you missed my last video on mobility, and it was all about upper body mobility, so you can go check it out. Now back to lower body mobility, we're going to loosen things up. And just a reminder, if you haven't subscribed to my channel, smash that subscribe button, click on that bell notification so you'll know when I upload my next video. So lower mobility, here we go. Today's all about lower body mobility. Hopefully, when you're done following these movements that we're doing today, you'll feel a lot smoother, less tense, you move around more efficiently, and also in less pain. Because let's face it, none of us really want to feel that we're in pain or achy or sore, right? So it's a great time, it's a great month to make sure you're doing more self-care for yourself and mobilizing correctly. So today I'm going to show you a simple lower body mobility routine where you can incorporate some tools if you have them. I'll be using a simple roller. If you don't have a roller, you can use anything that's got a bit more resistance to it. I would even say a metal water bottle usually works, right? It's all about how well your body can endure some discomfort, because it isn't, for most people, it isn't going to be pleasant, right? It's going to downright hurt. And that's because if your body's tight with knots and trigger points, those areas become more tender. And if you're rolling or kind of massaging them out, they don't feel great when it's being done, but after the fact, you do feel terrific. So if you've ever been a massage therapist, you know what I'm talking about. So today, it's just a simple roller if you have one, and I'm also going to use something a little more acute, and I'm using a lacrosse ball because it's a little harder. There's way less give. If you don't have a lacrosse ball, you can always try a tennis ball, but it's all about where your pain threshold is too and how much you really need it. For me, I've been doing this for a while, so I know how my body will respond to certain tools like this. And if you've never used self-care tools before, I would say make sure you take it easy and gravitate into using more, harder tools and more acute tools to really help break down scar tissue and knots. So for the first one today, it's a Shinbox scoop. So if you've actually seen some of my other past videos, I've done mobilizing of the lower body, and it's all body weight. So this is more of a Shinbox or a windshield wiper that you might have heard before. So to do this movement, you can place your hands back and just set yourself up into a position where you're about 45 degrees, right, angled. So listen to your own body if this is too difficult, or if you feel a lot of pressure in any part of on your lower body or your hips, don't do the movement. So in this position, once you're set up, you can place your hands in front of your front leg, and what I want you to do is just come down and scoop across. So you're just kind of coming in and scooping. You should be able to feel this in your hips, maybe even to your lower back, depending on kind of where your tension and your stiffness is currently. And it's a great way to kind of start opening up your hips and loosening any of those muscles into your core area, into the lower back. So you can also do it from the other side. Come down and scoop and scoop. If you can go further down, great. Now you can kind of go a little bit further and then scoop around. If that's too hard and too difficult for you, make sure just keep your body more upright, your arms more upright, and you can just do a scoop from up top and work your way down. And you want to be able to do this on the other side. So just transition your body again about 45 degrees. Hands down. Okay. Bend and scoop. I would recommend doing this for about 60 seconds. Right, I always feel, 20, 30 seconds is just not enough time to get your body to even begin to release muscle tension. So as you're going through, just kind of want to make sure you're mobilizing and pushing the range of motion. Go back the other way and up. And so if you can go down lower, great. You can also slow it down. You don't have to go quick. And really kind of work through your hip and into the lower back or into the glutes or the back of your legs. Everyone's going to feel it a little bit differently, and that's okay because you're trying to just mobilize your hip joints, maybe into your lower back, possibly around your patella. So it's all different for each individual. So that's more of a Shinbox scoop because you're just kind of scooping your body up and elongating the muscles that go into from your lower back into your lower body. So this next routine, I'm just going to use the roller. So if you've never used a roller before, make sure, I always recommend not to roll it over joints, right? So you don't want to be rolling it on top of your knee or behind your knee. You don't want to really be pushing too much right against any hard bone. So be careful when you're using this because the last thing you want to do is inflame your already tight or tense muscles. So for this, what I'm looking for are things we call trigger points, or I guess not scar tissues. So those little bumps that feel tender and they're not quite as pleasant to be on. So I'm going to start off on my glute. So my butt muscle, I'm just kind of sitting down and I'm just going to rock back and forth until I find something that's a bit more tender and or clunky. So when you find it, it's probably it'll feel kind of hard, and when you roll over it, you'll definitely know if that's a trigger point. And once you get to it, so if I'm rolling back and forth on my glute, so the top of my butt all the way down towards the bottom of the butt cheek, I can kind of feel there's a knot right in the middle there. And once I get on top of it, I always recommend doing 5 deep breaths, and you can knead it kind of like when you're I guess using a rolling pin and kneading dough. You're just kind of rocking back and forth, take your 5 deep breaths. You don't want to be sitting on one of these tense muscles too long because you just don't want to aggravate it. But what you want to do is help it release so there's less tension and your muscle releases, and then hopefully the knot or the trigger point goes away. You can also rock side to side and even around in circles. So once you get a feel for using a roller, you'll find different techniques that probably will work better for you. Next area, I'm going to do my IT band or my outer thigh into my hamstrings and down through my calves. So start off the top of your hip and go down through the side of your leg right before your knee. And most people will probably find this the most tender. So be careful when you're rolling back and forth on your IT band. Right. And then I'll transition into just rolling into my hamstrings, the back of the legs. I usually will keep my other leg on top just for added pressure, but like I said, listen to your own body. If it's too much, just leave the leg and brace with your arms and just kind of relax into the roller versus pushing down on it. I'm going to transition that onto my calf. I'm lifting my body up just a little bit, so I'm using a bit more of the gravity and my body weight and the weight of my leg to really dig deep into those really tender spots on my calf. And transition to the other side. So I was rolling on my outer thigh and behind the legs. I'm going to do a quick roll into the hip flexor and into the psoas, the front of the quad. Great thing about doing some self-care work and mobility work, you can do this at any time. You can do this in front of the TV, right before bed to relax the muscles, after workouts. Actually, before workouts is even better because if you're able to mobilize your body and have less restrictions when you're actually doing your exercising, you'll get a better range of motion, so you'll get better extension and contractions through your exercises, and hopefully that will give you better results. So that was a quick, probably 5-6 minute lower body rolling routine that you can do easily in your own home. This tool I'm using is the lacrosse ball, and because my glute, I can feel it's got a bit bigger knot that even the roller can't I guess help it break down as quickly. I'm going to be using this lacrosse ball for a more acute trigger point breakdown. So what I want to do with this is, because it's so aggressive on the body, is I want to be able to find the trigger point or the knot and gently sink down into it, take my 5 deep breaths, and then move on, because I don't want to be aggravating my muscle too much, especially with something this hard. You can also try using a golf ball. That's even more acute because it'll dig deep right into a smaller area. But this gives you a little bit larger surface area because I know the knot that I have is a decent size. So let's put that around my glute. Just gonna try to roll on top of it. Like I said, I've been doing self-care work for a very long time, so I kind of know exactly where certain areas are in improving them. So here we go, we found that. I'm just gonna sit on there with 5 deep breaths. Have my leg relax into it, because as soon as you feel discomfort, your body's normal reaction is to tense. And that's kind of opposite of what we want to do. So it's almost like, and move on to the next spot. It's almost like you want to trick your brain into thinking, even though it's maybe not as comfortable, you want to trick it into more of a, this feels terrific. And let your body relax into the tool to really help dig in and hopefully help release any of that muscle tension and scar tissue. There you go. That was using a few different tools, actually just a couple of different tools to help mobilize the lower body. Use these mobility exercises to help reduce aches and pains, move smoother, and hopefully just relax and de-stress your lower body. If you have any comments about any of these tools, or if you use other tools to actually help you mobilize better, leave in the comments below. I'd love to hear from you. And just a reminder, if you enjoyed this video, hit that subscribe button, click that bell notification, and you'll know when I upload my next video. But for now, check out a more personal look into my StayFitAnywhere lifestyle.